There are a number of cues I always look out for when I see somebody who I suspect has shame. And one, of course, is this downward gaze. So when individuals have significant shame, they often have difficulty looking me in the eye. And so you see this downward gaze. You also see this slumped posture. And that's often, a very big cue for somebody experiencing shame. So slumped posture, downward gaze, and lack of eye contact. And what I've learned from my patients is asking about eye contact is also a very good way of getting at shame. And for example, when I see my veterans or first responders, I usually use this scenario and I say to them, one of the veterans once told me, when I look anyone in the eye, I fear that they will see the stain on my soul. And I say to them, does that ever happen to you? And very often there's a pause, and then they tell me about the experiences they feel very ashamed about. When I see civilian clients with a lot of history of childhood trauma and where I suspect there are feelings of shame, I often ask, what's it like for you to look someone in the eye? And they often say to me, after a pause, I'm afraid that people will see how bad I am. And I think that's really the essence of shame, right? It is, I am bad, that feeling, I am bad. Whereas guilt is, I've done something bad. Shame is about feeling, I am bad. And so really asking individuals about what it's like to make eye contact, I think, really opens the door about getting at shame. I find asking about guilt and shame directly, just asking, do you feel guilt or shame? Often, you get something, but I find that you get a lot more information when you ask about what's it like to make eye contact.